All equipment for suctioning must be assembled and ready for immediate use. All equipment must be checked daily by trained personnel. All equipment should be with the child before starting. The equipment that you will need is a suction machine, a suction catheter. You always want to have a spare trach tube a half size smaller than the one currently in the child, saline or tap water to rinse the catheter with, a cup or container of saline or tap water for the rinse, saline for insertion of tube only if ordered, container of rinse for suction catheter, and gloves. After you have washed your hands and put on gloves, explain the procedure to the patient if available. Position the student in an upright position. Encourage the student to cough to expel secretions. If secretions have cleared and no sign of respiratory distress, do not suction. Open the suction catheter or kit without touching the inside of the package. If ordered, open saline for installation into the trach tube. Fill the cup or container with saline or tap water to rinse the catheter. Make sure that the suction catheter is firmly attached to the suction machine tubing. If the student has a Pasadena valve, you want to disconnect and set this aside. Turn the suction machine on. Encourage the student to cough and take a deep breath if available. Side note, you may be ordered to manually ventilate with an ambu bag twice. You may be ordered to insert prescribed amount of saline into the trach. Hold the suction catheter 2 to 3 inches from the tip with your dominant hand and insert into the saline. With the non-dominant hand, grasp the catheter connection, cover the vent opening with your thumb to suction a small amount of saline. Before you insert the tip into the trach, hold your breath. With thumb off the vent hole, gently and quickly insert the catheter into the trach the prescribed length. You want to be beyond the end of the trach tube. Cover the vent hole with thumb while withdrawing the catheter. Gently rotate with thumb and index finger while suctioning and withdrawing. This cannot exceed 10 seconds, which is why you are holding your breath. Allow the student to take several breaths or ventilate following their orders. Wait 30 seconds. If the respiration's clear, remove your gloves, wash hands. If moist, wet breath sounds are heard or mucus is seen, repeat suctioning process up to 3 times. Store and discard equipment based on orders. Remove gloves, discard and wash your hands. Document color, odor, consistency, and quantity of secretions. Report to school nurse if in the building or to the parents at the end of the day if there is a change from the child's usual pattern.